What is homelessness? Homelessness is what a person who has no regular, fixed, or adequate nighttime place of residence experiences. They stay in shelters, stay in temporary housing. They stay many places not designated for regular sleeping, like cars and tents and under bridges. Who are the homeless? Anyone can fall into this vulnerable population. All ages, genders, ethnicities, family groups, and educational levels. They're often poor, live in poverty, susceptible to high abuse. More than 22% have mental illness. Social factors affecting these people, families and children are at increased risk of homelessness. Many homeless had poor childhood experiences. 22%, as I previously said, have some form of mental illness. They have a high incidence of risky behavior, illicit drug use, and risky sexual practice. Many use public programs like food stamps, homeless shelters, or the food bank that's designated for those in poverty. Alcohol consumption rates in the homeless are 58 to 60% with men and 30% in women. There's a graph kind of showing the alcohol rates. Homeless is made up of all kinds of individuals. There's chronic homeless, veterans, family households, people in families, individuals. There's unsheltered, shelter overall. And I'm curious to see how the veterans thing is going to pan out with the recent wars that we've had and the soldiers coming home with the possible mental illnesses they're going to have to face as a part of being in the war. Over half are African American, quite 3/4 are a little less than half are white, and then we have Hispanic, Native American, and Asian in the United States. Problem was the deinstitutionalization of the mentally ill. This was a legislative decision several years ago to close many mental health facilities, mostly state-run, with the goal of putting these mentally ill back into the community with their families, or just to get a better quality of life. The communities were not able to deal with them because they weren't prepared. They weren't able to develop programs and such for these patients. So some patients were placed in supportive community housing. Some were placed back with family health caregivers, and they were unprepared, and there's no support programs. Some were previously supervised. Many of the now unsupervised chose to stop taking their medications, so they're not taking their medications, so it's not helping their mental illness. What support programs they did put together fell flat, leaving many of the mentally ill stranded with no help. Life on the streets was poor in quality compared to the institution life. Some of the things that they experience out on the street is violence, poor sanitization, and they are exposed to the elements. The average homeless person lives to be 44. That's almost half of what the person that has a home lives. Some cultural influencers. We look the other way when we see homeless people around us. They're not treated as equals. And substance abuse and violence, that brings on many cultural stigmas. The ethnic stereotypes, rejection by one group, acceptance by other. Rich reject the poor, and the poor embarrassed of many cultures and asking others for help. It leads to isolation. A little social support, poor education, healthcare resources are few. Depression and anger. This lack of support structure outside of the homeless community for those with health problems leads to acute and chronic exacerbations of health conditions, and they're left untreated to death. There's several risk factors: drug and alcohol, job loss, home foreclosure, domestic violence, homelessness, or mental illness, education, um, physical and sexual abuse, marital breakdown, childhood experiences, and as I mentioned before, the deinstitutionalization of the mentally ill. Shelter is a fundamental need that many take for granted. Providing shelter to the homeless would only decrease the length of the hospital's stays for the homeless. As I explained to you earlier, what homeless is, persons with no regular, fixed, adequate nighttime place of residence. And anyone can fall into this vulnerable population. Providing a stable living environment for the homeless will aid in controlling mental illness and health promotion of the homeless, very likely resulting in increased revenue for hospitals. Homeless people are very susceptible to both physical and mental health problems. As I said prior, their increased infection, or their increased risk for contracting HIV or TB. They're confronted with violent crime that results in assault. 2/3 have mental illness, and they're not receiving treatment for this mental illness. They spend all their time and efforts on surviving and preserving their health they don't feel is priority. The daily struggle for security, food, and safe shelter is what they experience. The constant struggle results in many homeless ignoring their health care. They're simply trying to survive. When homeless people do arrive to a hospital, they are in a crisis. They often have advanced disease and needs that are not medical. These needs are very difficult for hospitals to manage, and they result in lengthened hospital stays. Hospitals aren't prepared to take care of the mentally ill. Psychiatric admissions were 100 times higher in the homeless. The homeless do not have primary care physicians. Medication compliance is rare due to funds. The daily struggle is constant, and they're just simply trying to survive. Homeless are more likely to have an average of 4-day longer hospital stay. The average cost to cure alcohol-related illness is $10,000. Homeless patients on medical and surgical services remain hospitalized longer than house patients, resulting in substantial excess costs. Homeless patients admitted for psychiatric conditions have higher costs not explained by prolonged length of stay. The rates of mental and physical illness are high among homeless persons. Their access to health services is more difficult. They often do not have regular source of health care, and the daily struggle for food and shelter may take priority over mental illness and health care. Poor access to community service results in hospital overutilization. Sometimes they just come there to sleep. Healthcare professionals, particularly community nurses, have opportunities to collaborate respectfully with these clients and work for changes in public policies such as national housing and addiction treatment policies, and streamline humanized services to smooth the process of social reintegration. We can say it's not a responsibility to take care of the homeless. Doing so also protects the rest of the population by not spreading disease. Commonly, people think of homeless as beggars walking around looking for charity. We should be measured as a society by the way we treat our most vulnerable members. Our government should be doing much more than it is for the homeless population. There is no segment of the population with less access to health care than is the homeless. The only time many of the homeless get to see a doctor is during a visit to the emergency room. By the time that has happened, it can be too late. So in conclusion, homeless people are very susceptible to both physical and mental health problems. Poor access to community service result in hospital overutilization. Providing a stable living environment for the homeless will aid in controlling mental illness and health promotion of the homeless, very likely resulting in increased revenue for hospitals.